Let's talk about whether you can get rid of Helicobacter pylori, or H. pylori for short. Well, first of all, what is H. pylori? H. pylori is a microbe, a microorganism that prefers the environment of a human stomach. It survives and prefers the acidic environment, some other factors that are unique to the human stomach. So it won't grow in your colon like most bacteria, won't grow in your ileum, etc. It grows specifically in the human stomach. This was only discovered relatively recently in 1984 by two Australian scientists who, by the way, were poo-pooed. Their findings were poo-pooed for the longest time because up till then, it was thought that stomach ulcers were caused by stress and acidic foods and other factors like that. But there was always recurrences when they treated ulcers with acid-suppressing drugs like antacids or H2 blockers, or what are called PPIs, proton pump inhibitors like Acifex and Prilosec. There would be frequent recurrences of ulcers after acid-suppressing treatment. Well, it was discovered that the reason why there was so much recurrence was because there really was an infection. Ulcers, stomach and duodenal ulcers, that can often bleed, by the way, are infected with H. pylori. And it's eradication of H. pylori that prevents recurrence of stomach ulcers, bleeding, etc. Well, the appreciation for the implications of H. pylori, though, have grown since then. H. pylori is not just responsible for ulcers alone. It's responsible for a lot of problems. Now, who has H. pylori? Well, it varies in different parts of the world. In the U.S., it's around 20 to 35 or so % of the population have H. pylori. It varies geographically by age and other demographics, but it's not rare. It's not real common. It's not 90%, but it's probably about 1 in 4, 1 in 3 people, something like that, have H. pylori. In other parts of the world, it can be even much more. It can be 50% or more of the population has H. pylori. But what are the implications? Let's put aside the question of stomach ulcers. What are the consequences? What are the implications of having H. pylori in your stomach? Well, there's a long list. For one thing, it can indeed cause hyperchlorhydria, excess stomach acid, particularly in the early period. And that's why it responds to acid-suppressing medication. Long term, it tends to cause hypochlorhydria, that is, low stomach acid. And that's where people say things like, I can't eat meat because it sits in my stomach forever. Or they say things like, I have a hard time digesting food and it gives me a lot of heartburn and acid reflux. Now, once you have hypochlorhydria, low stomach acid, the level of gastrin, the hormone gastrin, goes up because it's your body's effort to increase stomach acid. And gastrin induces stomach acid production. But the gastrin level goes up and you're unable to produce more stomach acid because of the damage inflicted by H. pylori. And that high gastrin level causes the stomach lining to grow, proliferate. That's what leads to stomach cancer. So one of the long-term consequences of hypochlorhydria, increased gastrin, is stomach cancer. So yet another reason why you want to know if you have this thing or not. Many skin rashes are worsened by H. pylori. The standout is rosacea. In fact, if you eradicate H. pylori, it has beneficial effects on rosacea that are as good as or better than drugs intended for rosacea. So eradicating H. pylori when you have rosacea is a very effective thing to do. Parkinson's disease, which is a progressive neurodegenerative disease, eventually fatal. Well, if you eradicate H. pylori, Parkinson, the signs and symptoms like tremor and the difficulty walking and speaking recede partially. And sometimes the effect is better than Parkinson's drugs. So identifying that eradicating H. pylori can be an important component of an effort to slow the progression of Parkinson's disease. Coronary disease, heart attacks, need for bypass and all that sort of thing. There seems to be an especially virulent form of H. pylori that can be associated with coronary disease. Not quite clear how and why that happens, but there is a clear-cut association. Autoimmune diseases. Now, autoimmune diseases are caused and perpetuated by other factors, like initiated often by the gliadin protein of wheat and related grains, for instance. Vitamin D deficiency doesn't cause autoimmunity. It allows autoimmune conditions to emerge once the trigger, like the gliadin protein, has initiated the process. But H. pylori can add to the process. And so, once again, eradication of H. pylori can give you an added edge in suppressing or reducing any autoimmune phenomenon. SIBO. SIBO is everywhere. Small intestinal bacterial overgrowth, a situation in which colonic organisms, unhealthy colonic organisms like E. coli and Campylobacter, have emerged up into the small intestine, the ileum, jejunum, duodenum, up through as much as 24 feet. And so you have essentially 30 feet, including the colon, of bacteria. It's highly inflammatory and leads to body-wide inflammation, has all sorts of consequences like fibromyalgia, irritable bowel syndrome symptoms, worsening ulcerative colitis and Crohn's disease, worst partial recovery after gluten removal for people with celiac disease. It can trigger diverticular disease and leads to colon cancer. So SIBO is very important. About half the people who have H. pylori also have SIBO. It's not quite clear if H. pylori causes or contributes to the SIBO. Now, if you have hypochlorhydria, that clearly contributes to SIBO, but it's not clear whether H. pylori per se contributes to SIBO, but the two coexist very commonly. And then lastly, the very common triad of fatty liver, where there's fat accumulation in the liver, insulin resistance, where your muscle and liver and other organs don't respond to insulin, and you have really high levels of insulin in response, and inflammation. So fatty liver, insulin resistance, and inflammation very, very commonly occur or co-occur together. H. pylori can make those situations worse. And that's the stuff that leads to progressive liver disease, type 2 diabetes, and other forms of inflammatory phenomena. So H. pylori is very, very important. So what can you do? Well, you know what? You can identify whether you have it on your own. You know, one of my programs is called Undoctored, and it's described in my Undoctored book and the Undoctored blog. And one of the things I love doing is showing people how to manage their own issues on their own. Now, we all start, by the way, with the basic Undoctored program, which involves dietary changes, no grains, no sugar, vitamin D restoration, magnesium, and omega-3 fatty acid supplementation, iodine and thyroid optimization, and efforts to cultivate a healthy microbiome. But you can go farther, because those basic efforts, as effective as they are, as effective and wonderful and magnificent as the results can be of those basic menu of strategies, like reversing type 2 diabetes and losing 73 pounds, and often at least partial, if not total reversal of autoimmune diseases, you can go further. Because the basic efforts will not eradicate H. pylori. You have to make a very specific effort to eradicate H. pylori. Now, you know, conventional healthcare is not very effective for this. The conventional 3 or 4 antibiotic regimens are only about 55-60% effective. As a result, there's been a search for other natural alternatives. And so one of the great developments in the world of H. pylori is that we have a long list of choices that are natural, safe, and available to you without the doctor or the hospital. So step one, you want to see whether you have it or not. There's a blood test you can do. It's a Fingerstick. You do it in your own kitchen. It's like $12 or $13. Very inexpensive, but only useful for initial diagnosis, not useful for follow-up, because once you've had the antibody triggered, you remain positive for an extended period, even if the organism has been eradicated, okay? So you can do a Fingerstick blood test. There are also stool tests. Stool tests are the gold standard, and you can get them done for less than $100, the stool tests. I'll list below a couple of the resources where you can get these things on your own. Now, if you prove positive, and by the way, the stool test can be used both for initial identification and for follow-up, okay, to see if you eradicated it, because you really want to know if you've eradicated something. So don't use the antibody test to assess for eradication. Use the stool test. There's also a breath test, but I'll tell you the breath test is a pain in the neck. I wouldn't do that. I would just do the stool test, because this little stool sample, send it off, it comes back positive or negative, right? If you have it, you have the means to eradicate it with at least as much success or more than your doctor can, because he's going to give you conventional antibiotic advice and prescriptions that are not that effective. So you can use tools like Nigella sativa or mastic gum or vitamin C, high-dose vitamin C, or N-acetylcysteine. Now we use several of them together, just like they do in conventional therapy, like 3 or 4 of them. And you do that for about 10 to 14 days or so, and then you want to reassess. Now, the details on how to do this are covered in my Undoctored Inner Circle. So this is like SIBO management. SIBO management is a little more complicated, and I think people do better by having a back and forth conversation, discussion, some feedback, and some support and guidance on how to do this best. Because these kinds of efforts, SIBO eradication, H. pylori eradication, are a little bit more complicated. And because if you're going to do this without your doctor, you do want to have some feedback and some guidance. So I invite you to join my conversations that we have all the time in the Undoctored Inner Circle website. That's my membership website. And we have a protocol, or a suggested protocol, on how to eradicate H. pylori. Okay, so I invite you to join those conversations, and you can see all the choices you have in crafting a regimen for eradicating H. pylori on your own, if you have it.